Right here from ITC Dubai 2026. We're very delighted to be joined by Professor Sherif Khaled, Professor of Orthopedic Surgery at Ainy, Cairo University. Professor Sherif, we're very happy to have you with us here today on OrthoHouse.
Thank you very much for the introduction, and I'm equally happy to be here with you.
What is your vision on developing the future of orthopedic surgery over the coming years?
Already orthopedic surgery is going very fast. The technology is advancing every day. We have a lot of companies, a lot of technologies being added every day. And especially in Egypt, we have a large population, a large number of orthopedic surgeons, and they are all very enthusiastic to learn every new technology. And thanks for the companies in Egypt, they are supporting all these surgeons to keep advancing. And I think for the future, the robotics are coming strongly, and AI is as well coming strongly for the education of young generation.
Speaking about the anterior approach, do you believe that the anterior approach can be more beneficial to patients, particularly young ones?
Since I learned the direct anterior approach, I find it a very good addition to the armamentarium of our approaches for the hip. It is an approach that's been well established since 1998. Maybe at the end of the first year after the surgery, the results between the anterior, lateral, and posterior are equivalent. But definitely in the first few months, there is a big functional difference between the direct anterior and the other approaches. And I think that for young patients, they do prefer the direct anterior approach, or they feel it looks nicer, or it has a more cosmetic advantage than the other approaches. But still, every surgeon is comfortable to do a certain approach. So we teach the young surgeons that whichever approach you're comfortable doing, it's going to be best in your hands. But in my case, for young persons, personally, I prefer the direct anterior approach. It's definitely an addition. It's definitely a plus.
You spoke earlier about AI and robotics, and indeed, Egypt is a major regional hub, actually, with a population exceeding 120 million. In that context, how do you see the future of robotics in knee and hip surgeries?
It should be a good future for Egyptians. I went for a training on robotics a few years ago. Maybe 2017 with a company in Egypt, but unfortunately due to some economic situation the robot did not arrive, he did not make it. But nowadays I see that most of the companies are focusing on doing these trainings in waves for most of the surgeons that do arthroplasty, and I hope that in 1 year from now most of the Egyptian surgeons that are doing arthroplasty will be exposed to robotic surgery, will start practicing robotic surgery, and definitely this is going to be a plus for a big population like Egypt, a population of 110 million, excluding also patients that we operate from the rest of the Middle East like Yemen, Libya, Sudan, and other neighboring countries. And I think that with these waves, in a very short time, most of the surgeons will be able to do robotic surgery if the robot will be available in our country, and I hope it's going to be available very soon, thanks also to the companies that are pushing for this to happen.
Professor Sherif, if you would send a message to OrthoHouse, what would it be?
Message to OrthoHouse, that's a difficult question. I would like to thank OrthoHouse for the support of orthopedic surgery in Egypt. They've been with us for a long time. They've been dedicated to orthopedics, and personally I do arthroplasty. I use arthroplasty from their company but also from other companies, but they never failed me in any of the cases, and I wish they can continue what they are doing as a support for orthopedic surgeons, young and experienced orthopedic surgeons. I wish they continue what they are doing in bringing the best implants to Egypt and doing their best to provide an excellent service.
Professor Sherif Khaled, Professor of Orthopedic Surgery at Ainy, Cairo University. Thank you so much for being with us here today on OrthoHouse.
Thank you very much. Thank you.